Hey everyone, and welcome to the Deep Dive. We're going to be taking a close look at a topic that's super relevant for all you future nurses at UTMB, schizophrenia and psychosis.
Definitely conditions you'll likely come across in your careers.
For sure, and they can seem pretty complex at first, so we're here to break it all down, make it easy to understand.
Exactly. And even for experienced nurses, sometimes it's good to have like a little refresher, you know?
Absolutely, a refresher never hurts.
And it's more common than people think. Schizophrenia affects something like 1 in every 200 people.
Wow, I had no idea it was that common. So, before we get into schizophrenia specifically, can you explain what psychosis is? It sounds kind of intimidating.
Yeah, it can be, but understanding it is so important for helping patients. Psychosis is basically when someone experiences a break from reality. Like, imagine having beliefs that are really strong, but they don't match up with what's actually true. You know, that's what we call a delusion. Or think about hearing voices when no one's around. That's called a hallucination.
So both of those are signs of psychosis?
Exactly. They're hallmarks of psychosis.
Okay, so is psychosis like the umbrella term, and schizophrenia is a type of psychosis?
You got it. Schizophrenia is a chronic brain disorder that falls under that category of psychotic disorders, and it's neurodevelopmental, which means it affects how the brain develops and grows.
So it's not just one thing going wrong in the brain, right? It's more complicated than that.
Yeah, it's definitely more complex than that. It's like a whole mix of things. Genetic factors, biochemical imbalances, and even life experiences all contributing.
So it's like nature and nurture both playing a role.
Absolutely. You could have someone who's genetically predisposed, but then a stressful environment could trigger the onset of symptoms. That's why understanding the phases of schizophrenia is so crucial, especially for you all just starting out in nursing.
Okay, yeah. Like, how does it typically progress?
So it's kind of like a roadmap, helps you understand how the disorder might unfold.
Okay, I'm all ears, lay it on me.
Okay, so the first phase is called the pre-morbid phase.
Pre-morbid.
Yeah. Think pre, meaning before, and morbid, relating to disease. So this is the phase before any clear signs of schizophrenia actually show up.
So are there any warning signs during this pre-morbid phase?
There can be. Sometimes it's subtle, but imagine a teenager who is always outgoing, life of the party, and then suddenly they become withdrawn, they isolate themselves, maybe their grades start slipping, or they have trouble concentrating and their thinking seems a little bit off.
Ah, so you're saying changes in behavior, personality even.
Right. Those can be potential early indicators, especially if they happen in childhood or adolescence.
So early detection is really important then.
Huge. If we can recognize these early signs and intervene early, we might be able to delay or even prevent the progression to the next phase, which is called the prodromal phase.
Okay, so what happens in this prodromal phase?
Think of it like the calm before the storm. You start to see a more noticeable decline in the person's functioning. They might experience depression, anxiety, and they might withdraw even more from social situations. They may also start having problems with thinking clearly, remembering things, or making decisions.
So it's like they know something's off, but they can't quite put their finger on it.
Exactly. It's that feeling that something's not right. And it's a crucial time for intervention because if we can provide effective treatment during this prodromal phase, we might be able to prevent or lessen the severity of the next phase, which is the active psychotic phase.
Okay, and this is when things get really serious.
This is when those more obvious symptoms, the ones people typically associate with schizophrenia, start to appear. This is the phase where people might experience hallucinations, delusions, and really disorganized thinking.
You mentioned delusions before. Can you give me some specific examples of what those might look like?
Sure. One common type is what we call persecutory delusions, where the person believes they're being followed, spied on, or even harmed. Like, imagine someone truly believes their neighbor is trying to poison them, even though there's absolutely no evidence to support it.
Wow, that's intense.
Yeah, and then there are grandiose delusions, where someone believes they have extraordinary abilities or powers, like they might think they can control the weather, or that they're a famous celebrity, even though they're not.
Oh.
And then there are somatic delusions, which are false beliefs about the body. So someone might be convinced they have a rare disease or that their organs are failing even after medical tests show that everything's normal.
That would be so scary to experience.
It can be. And then, of course, there are the hallucinations.
Right, and you said those are sensory experiences that feel real but aren't actually happening?
Exactly. And the most common type in schizophrenia is auditory hallucinations, which is hearing voices. So imagine someone constantly hearing voices that are criticizing them or telling them to do things.
That sounds terrifying.
It can be. And then another key symptom is disorganized thinking, which often shows up in the way a person talks.
Like how?
Well, they might jump from one topic to another that's completely unrelated. They might make up new words, what we call neologisms, or their sentences might be so jumbled that it's almost impossible to understand, like a word salad.
Wow. I'm starting to see how challenging this can be for both the person experiencing it and the people trying to care for them.
Absolutely. And even though these active psychotic symptoms might eventually lessen, there's still another phase we need to talk about, the residual phase.
Okay, what's the residual phase like?
Imagine the storm's past, but there's still damage left behind. The most intense symptoms might have subsided, but there are often lingering challenges, what we call negative symptoms.
Negative symptoms are different from hallucinations and delusions then.
Right. Think of positive symptoms like adding something to a person's experience, like those hallucinations or delusions. Negative symptoms are more about things that are missing or diminish.
I see. So what are some examples of negative symptoms?
Well, imagine someone who used to be really expressive and animated, full of life, and now they show very little emotion. That's called flat affect. Or someone who was once really active and engaged, but now struggles to get out of bed or take care of themselves.
Like they've lost motivation.
Right. That can be a sign of avolition, which is a lack of motivation. And apathy is when they lose interest in things they used to enjoy. These negative symptoms can be just as debilitating as those positive ones.
Wow. This is all so important for us to know as future nurses. So we've talked about the different phases, the positive symptoms, and the negative symptoms. What's next on our deep dive roadmap?
Now that we've got the basics down, let's move on to the different approaches to treating schizophrenia. And it's not just about medication, although that's important. We're going to be diving into a whole range of therapies and support systems that can make a world of difference for individuals with schizophrenia.
So we're back and ready to dig into those treatment options.
Okay, great. Because it's not just about, getting rid of symptoms. It's really about helping people with schizophrenia live fulfilling lives.
Yeah, absolutely.
And that often involves a bunch of different approaches kind of working together. One important piece is individual therapy.
Okay, what's the focus there?
It's all about giving people the tools and skills to understand their own thoughts and feelings and behaviors and learning how to cope with the challenges of schizophrenia.
So like if someone's struggling with paranoia, for example.
Exactly. Therapy can help them identify what triggers those feelings of paranoia, and then they can start to develop strategies to deal with those thoughts and emotions.
That makes a lot of sense. So what about group therapy? How does that fit into the picture?
Group therapy can be so powerful for people with schizophrenia because imagine you're in a room with others who really get it,
Yeah, people who've been there.
Exactly. They understand what you're going through without judgment.
I bet it helps with those feelings of isolation, too.
For sure. It helps people feel less alone. And it's also a great place to practice social skills and learn from each other's experiences. It's a safe space to share, learn, and grow.
That's awesome. You mentioned family therapy earlier, too. Why is it so important to involve families?
Well, families are often the primary caregivers and support system for someone with schizophrenia. So family therapy helps educate them about the disorder, what to expect.
Right, because it can be so confusing for families, too.
Absolutely. And family therapy helps improve communication between family members and gives them strategies to support their loved one in a healthy way.
I can see how that would make things so much less stressful for everyone involved.
For sure. It's all about working together as a team. And then there's cognitive remediation therapy, which is another really valuable approach.
Cognitive remediation therapy. That's a mouthful.
It is. Haha. But it's basically focused on improving cognitive skills, like attention memory and problem solving, all those things that can be affected by schizophrenia.
Yeah, those are like essential skills for daily life.
Exactly. And this type of therapy is kind of like brain training. It helps those neural pathways fire up again.
So it's like physical therapy, but for the brain.
That's a great way to put it. By practicing specific tasks and exercises, people can actually strengthen those cognitive skills, which can lead to more independence and a better quality of life.
Makes sense.
Yeah.
So if we got individual therapy, group therapy, family therapy, and cognitive remediation therapy. What else?
Well, those are great options, but sometimes therapy alone isn't enough, especially for folks with more severe symptoms. That's where assertive community treatment, or ACT, comes in.
ACT, what's that all about?
Think of ACT as this wraparound service, a super comprehensive program that provides a whole range of support.
Okay, like what kind of support?
Well, it includes things like medication management therapy, vocational support, and even help with housing.
Wow, that's a lot. It's like a one-stop shop for support.
It kind of is, and stable housing is a big part of it because it's tough to focus on your mental health if you don't have a safe place to live.
Absolutely. You can't work on anything else if you don't have those basic needs met.
Right. And ACT teams are really unique because they meet the individual where they're at. literally, you know.
Mm.
They provide support in the community, in the person's home, wherever it's needed.
So it's like they come to the person instead of the person having to navigate all these different systems.
Exactly. It takes a lot of the pressure off and makes it easier for people to get the help they need.
I like that. Now, you also mentioned something called the recovery model. What is that all about?
So the recovery model is all about empowering individuals with schizophrenia to live meaningful and fulfilling lives, even with the challenges.
Okay, so it's not about being symptom-free necessarily. It's
No.
more than that.
Right. It's about recognizing that recovery isn't a straight line. It's a journey with ups and downs.
Mhm.
And it emphasizes hope, self-determination, and the belief that people with schizophrenia can achieve their goals.
So it's like shifting the focus from illness to possibility.
Yes, exactly. It's about looking at the whole person, their strengths, their talents, their aspirations. And within the recovery model, there are two types of recovery that we talk about: functional recovery and process recovery.
Okay, what's the difference?
Functional recovery focuses on those practical things, improving skills and abilities so someone can be as independent as possible, like managing their symptoms, developing coping mechanisms, getting back to work or school or whatever activities they enjoy.
So it's like getting back on track with life.
Right. And then process recovery is more personal. It's about that ongoing journey of self-discovery and finding meaning and purpose in life despite the challenges.
It sounds like a more holistic view of recovery.
It is. And speaking of early intervention, there's a program I want to mention that future UTMB nurses should know about called RAISE.
RAISE.
Yeah, it stands for Recovery After an Initial Schizophrenic Episode.
I'm sensing a theme here. Early intervention is key, right?
Absolutely. The sooner you can provide support, the better. And RAISE is designed to do just that. It's a really comprehensive program that brings together medication therapy, family support, and even help with education and employment.
Wow, so they're really setting these young people up for success.
Exactly. And it's focused on people experiencing their first episode of psychosis, giving them the best possible chance to build a good life.
That's fantastic. Are there any promising results from the program?
Definitely. They've seen some really great outcomes with RAISE improvements in symptoms functioning and overall quality of life.
That's so encouraging to hear. Okay, so we've talked about a whole bunch of different treatment approaches, everything from individual therapy to community-based programs. What's next on the agenda?
Now that we have a good understanding of those treatment approaches, let's talk about medication, its role in managing schizophrenia.
Okay, yeah, you mentioned antipsychotics earlier. Let's dive into those.
Oh.
Okay, so let's talk about those antipsychotics. What exactly are they doing in the brain?
Well, think of them kind of like a volume knob. You know how in schizophrenia, certain brain chemicals can be out of whack?
Yeah, you mentioned dopamine specifically.
Right, dopamine's a big one. And antipsychotics, they help to regulate those chemicals so things aren't so intense.
So it's not that they cure schizophrenia, but they help manage the symptoms.
Exactly. They kind of give people some breathing room so they can focus on other aspects of recovery, like therapy and building those life skills.
That makes sense.
Okay.
Are all antipsychotics the same, though?
Actually, there are two main types, typical and atypical.
Okay, what's the difference?
So the typical antipsychotics, those were developed first, and they can be really effective, but they also come with some side effects.
In the atypicals.
Those are newer and tend to have fewer side effects, but everyone's different. So it's really about finding what works best for each individual.
So there's a bit of trial and error.
It can be, yeah. Which is why it's so important for nurses to be really observant and communicate closely with the doctor and the patient. Make sure everyone's on the same page.
For sure. So let's say I'm a nurse on a psych unit and I have a patient with schizophrenia. What are some of the most important things I should keep in mind?
Well, remember all that stuff we talked about with therapeutic communication, approaching your patients with empathy, validating their feelings, and not arguing with their delusions.
Right. Building trust is huge.
Huge. And you also want to be a keen observer. Are they showing any signs of hallucinations? Are they withdrawing from others? Are they struggling to do everyday tasks or hold a conversation? Those observations can tell you a lot about how they're doing.
What about those command hallucinations? We talked about those earlier. Those seem particularly concerning.
They definitely can be. If a patient tells you they're hearing voices, telling them to hurt themselves or someone else, you need to assess the risk right away.
Like ask them directly if they're planning to act on those voices.
Exactly. You got to be direct, but also compassionate. It's a delicate balance.
I can imagine. And what about those negative symptoms? How can nurses help with those?
Negative symptoms can be really tough because they often don't respond as well to medication. So it's really about encouraging your patients to participate in therapy, to do activities they enjoy, to set small, achievable goals,
So trying to rekindle that motivation and engagement.
Exactly. And don't underestimate the power of just being present with them, listening to them, celebrating their successes. Even small victories can make a big difference.
That's good advice. Okay, so we've covered a lot about caring for patients with schizophrenia. What about the medication itself? Any tips for nurses in terms of managing and educating patients about their meds?
Definitely. Make sure they understand why they're taking the medication, how to take it properly, and what side effects to watch out for. Those
Yeah.
conversations can be tough, but they're super important.
For sure. Knowledge is power, right?
Absolutely. The more your patients understand, the more likely they are to stick with their treatment plan.
And that's what we want ultimately. We want them to feel empowered to take charge of their own health.
Exactly. And one last thing I want to say to all you future UTMB nurses out there. Don't be afraid to ask questions. Consult with your colleagues. Seek out continuing education opportunities. Schizophrenia is complex. There's always more to learn.
That's good to hear. It's okay to not have all the answers right away.
Of course, nursing is a lifelong journey of learning. You're always going to be growing and developing your skills.
Well, I feel like I've learned so much today, and I'm sure our listeners have too. So to all our future nurses listening in, remember, knowledge is power. Empathy is key. And you have the potential to make a real difference in the lives of people with schizophrenia.
Couldn't have said it better myself.
Thanks for joining us on The Deep Dive.